Good morning. My name is Brenda Campbell. I am CEO of Superlative Child Care and Superlative Academy here in Charlotte, North Carolina. I am here today to talk to you about opportunities for states to improve benefits, access for home-based child care providers. We have heard the sound bites. Child care is the backbone of our economy. Child care is the workforce behind the workforce. But our current policy approaches do not reflect that. In fact, the child care workforce has nearly 90,000 fewer child care professionals today than in early 2020. Without enough providers and caregivers, children, parents, employers, and communities are feeling enormous strain. To address the current shortage of care, we must address the needs and well-being of our child care workforce. News and research reveals that home-based child care providers, HBCC, struggle to make ends meet, have unstable incomes and variable levels of access to essential benefits like health care and retirement. Nearly 6.4 million children from birth to age 5 receive care in a home-based child care setting. Home-based child care is most prevalent child care placement for infants and toddlers, with 30% of infants and toddlers attending home-based child care as their primary arrangement compared to just 12% in centers. The RAPID project at Stanford Center for Early Childhood documents that home-based child care providers, including both licensed family child care, FCC, and licensed exempt family, friends, and neighbor, FFN, caregivers are struggling. Family child care providers report 33% are struggling with at least one hardship, struggling to afford food, struggling housing, struggling to pay utilities, while 44% of FFN caregivers report hardship. RAPID reports this in 2021. 1 in 3 early childhood workers is going hungry, including 26% of family child care providers and 34% of FFN caregivers. 19% of early childhood workforce holds student debt. 17 reported that they are carrying educational debt of others. 38% of providers worried about eviction, and 22% are worried about foreclosures. Additionally, many providers have other incomes and rely on second jobs and carry other forms of debt, medical debt, credit card debt. Addressing wages is a key part of ensuring the well-being of the workforce. However, access to benefits is essential to ensure the members of this workforce are healthy and can retire with dignity and can support their families. Help us to help you, to help the workforce. This has been Brenda Campbell, Charlotte, North Carolina, Superlative Academy and Superlative Child Care. This report comes from Homegrown, and this is information that is based on the RAPID project at Stanford Center for Early Childhood. Help us, North Carolina. Help us to help the early care workforce be better. Let's build back better early childhood here in North Carolina. This has been Brenda Campbell, Superlative Academy, Superlative Child Care. Thank you.